Aspirations, Global Health Solutions. Thank you so much and welcome to today's YouTube live stream. This evening, we're going to look at primary and secondary infertility. So, what are the secrets? Top 5 secrets about primary and secondary infertility. So, very important. So, remember that infertility is a pandemic. So pandemic means something that affects the whole world. So as I'm talking to you guys right now, the same level we have COVID, it's the same level we have infertility. Infertility is globally defined by WHO as the inability of two individuals, a man and a woman, who are constantly making love without contraceptive, the inability to achieve pregnancy within a period of 1 year. So that's number one point you have to note. Now, when we begin to break it down further to sub-definitions, depending on the age of the woman, infertility can also be modified. So if you are 35 years and above, infertility can further be modified to be the inability to succeed in becoming pregnant after a period of 6 months. So if you're 35 years and above, 6 months. If you're below 35, 12 months, which is correspondingly 1 year. So if you are in this category, you are 35 years and above, you and your partner are making love consistently, regularly, without any contraceptive. So remember, in our group, our recommendation is 48-hourly lovemaking. Now, at the expiration of the 6th month, if you are not able to achieve pregnancy, you are classified as having infertility. If you are below 35 and you are making love regularly, 48-hourly, and at the expiration of the 12th month, if you are not able to have a baby, you are classified as having infertility. But this evening, we want to look at primary and secondary infertility. So number one secret, primary and secondary infertility is actually different based on the ability to have achieved pregnancy in the past. So number one point is to know the difference between the two of them. In primary infertility, a man or a woman has never become pregnant or impregnated somebody in the past. So in primary infertility, you never had any positive pregnancy test at all. Your girlfriend, your wife, or whoever never told you that you got her pregnant. That's primary, never, ever been pregnant. Now, in secondary infertility, in the past, you got pregnant. Now, there's a caveat. You got pregnant by yourself without any help, but currently, you were not able to achieve pregnancy. So that's secondary. So secondary means in the past, you achieved pregnancy, but currently, you were not able to achieve pregnancy. Now, when you become pregnant, there are principally 3 things that can happen. You can have the baby, you can terminate the baby by wanting to remove the baby through the process of abortion, or you can have miscarriage or stillbirth. So these are possibilities in pregnancy. So in secondary infertility, probably in the past, you had your pregnancy, you had your baby, you terminated the pregnancy, or you had miscarriage, or you had stillbirth, but you've been confirmed to be pregnant in the past. So that's number one secret. Number two, your ability to be diagnosed with primary and secondary infertility is actually directly tied to your age. Now, any woman and any man can have primary infertility. So when you have primary infertility at any age, it can happen to a man, it can happen to the woman, but it's more pronounced in women in regards to secondary infertility. So regarding your age, the age of a woman is the biggest factor that will predict her ability to become a mother. So when you were born, you came into this world with your eggs by default. So all the eggs you will use to start your family, you came into this world with it. Now, over time, you begin to have decline in your egg, both in the quantity and quality as a woman. Now, this decline will be slow until you get to age 30. When you get to age 30, there will be a little bit of increase in the decline of the quality and the quantity of your eggs. By the time you get to 35, it's accelerated. So you will begin to lose your eggs, both in quality and quantity, in an accelerated mode. This is why women from 35 years and above are called advanced in maternal age. So secondary infertility can be a big player in a woman that is above 35. So age is important. A woman will not be fertile for the rest of her life. A man will also not be fertile for the rest of his life, but a man can father a child later in life, even up to age 90 in some situations. But once women exhaust the eggs they have, they go into menopause. So age is a very big player when it comes to both primary and secondary infertility. So if you were able to achieve pregnancy in the past, maybe when you were in your teens, 18, 19, or maybe when you were in your 20s, but currently you're in your 40s, you're not able to achieve pregnancy. What type of infertility do you have? Secondary infertility, of which age is a big player. So if you happen to find yourself in this category, we need to look at your egg reserve. We need to look at the quantity and the quality of eggs you still have remaining. Very, very important. So number one secret is to know the difference. Primary infertility can happen to a man. Primary infertility can happen to a woman. It simply means you were not able to become pregnant and you were not able to impregnate anybody up to this point, and you're still trying. But in secondary infertility, you became pregnant as a woman in the past. You had a baby, you terminated the baby, or you had miscarriage, or you had stillbirth. Or you as the man got your wife pregnant, your girlfriend pregnant, or another girl pregnant, and it was confirmed is your baby, right? And you didn't get any help. So there's a caveat. WHO actually added a caveat. So you would have had this without the help of any fertility, management. Now, the other point we have to note as a secret for primary and secondary infertility is the fact that it can also be due to structural problems in the body of a woman. Top on the list is tubule problems. So a woman might have primary infertility if she has never really been sexually active, or if growing up she picked up a couple of sexually transmitted infections, of which we are interested in two: chlamydia and gonorrhea, and it damaged your tubes. So primarily, you have never been pregnant because your tubes were damaged. Or it can be secondary infertility from tubal factor because previously you were able to become pregnant when your tubes were healthy, but after you became pregnant, you damaged your tubes and you could no longer achieve pregnancy right now. That means you have secondary infertility due to tubal factor. Now, some women can also have some issues with the womb. So if in the past you were able to achieve pregnancy, but you went for illegal abortion, and in course of doing that illegal abortion, they caused what we call Lasharma Syndrome. So what's Lasharma Syndrome? In course of going for dilatation and curettage, which is a method of removing the baby, they excessively scraped the cover of your womb, which is called the endometrium. And when it was healing, it healed with extensive adhesions. Anywhere you have adhesions in the body, it's going to affect the function of that particular part of the body. So when you have adhesions in the tube, it's going to block your tube. When you have adhesions in the womb, it's going to affect the function of the womb. Remember that the cover of your womb is called the endometrium. It's supposed to be thick enough to welcome pregnancy during the process of implantation. So if you have these adhesions from previous surgery, some people can also have endometriosis or previous delivery or previous myomectomy. And when the womb was healing, it healed with what we call secondary intention. When you have that, you have adhesions, and it can lead to either primary or secondary infertility. So that's another point to note. Now, another point, which is also a secret, is the fact that primary and secondary infertility can happen to anybody. So infertility is not just only women. So a man can have primary infertility. A woman can have primary infertility. A man can have secondary infertility, and a woman can have secondary infertility. So it's pretty much about 50% distributed. So when you hear about infertility, it's a factor that can affect both parties equally. So it's not a woman problem until we have investigated to discover where the problem is coming from. It can come from anybody. Now, when we compare the infertility management in primary and secondary, for some reasons, which logistically you can actually make sense out of it. If you were able to achieve pregnancy in the past, the possibility you can achieve pregnancy again is very high. So by default, it's more difficult to manage primary infertility compared to secondary infertility. Most women that were sexually active or they have been trying to become pregnant and they have not been pregnant at all might find it difficult achieving pregnancy at all. But if you were pregnant in the past, but currently you're having problem, you have secondary infertility, we can actually go for fertility assessment. So we might discover your tube is blocked, we might discover you have hormone imbalance, we might discover your body weight is affecting you, and when we fix that, we can solve secondary infertility. But the problem in primary infertility might be the fact that there are some structural problems, you might have some syndromes, you might have primary ovarian failure. So primary infertility compared to secondary infertility is more difficult to handle. Now, this is where you need to act on time. So if you're a member of our community and you're having infertility, one of the questions you have to ask your doctor is, what type of infertility am I having? And you can also diagnose yourself. So if you are truthful to yourself and you're honest, you will definitely know when you were pregnant, right? So you can't forget the history of your pregnancy. So if you were pregnant in the past, when you were doing boy and girlfriend, but right now you don't have, you're not pregnant, then you have secondary infertility. But if since you started lovemaking must be in the equation. So if you're a virgin, you don't have any business with infertility. You don't have infertility. You would have had infertility by the time you and your partner have been making love regularly. So if you're a virgin, you haven't had any sex, then you don't belong to the infertility, category discussion. You're just a virgin. You haven't really tried penile sex. Okay? But if you have tried penile sex in the past without protection and you were not able to become pregnant, you can self-diagnose secondary and primary infertility. So this is where the moment of truth will come. Now, I'm going to give you a very, very important advice. Sometimes the two couples will be fine and we won't find out what the problem is. They will have what we call unexplained infertility or infertility of unknown origin. Now, don't wait till forever to seek help. If you happen to be in the category of people that have not defined why you go for this is, and anything you're not going to get result is high. Why? Because the older you get, the more difficult it becomes. So if you are currently 35 and above, it's time to sit up and sit in the front seat because you don't have much time. Conventionally, I'm just trying to cheer you up. I'm not trying to put fear in you. I want you to sit up and do something about your situation. So sometimes we'll run all our gamut of investigations for the males, for the females. Your partner's semen analysis is good. Everything about you is good, but still you are not able to become pregnant. You are better served doing something early if you have primary infertility. So it will be more difficult to overcome the challenge of primary infertility compared to secondary infertility. Thank you so much. Please feel free to ask your questions. It's time for questions and answers. I'm going to provide you feedbacks. So if you have any questions, please feel free to ask about right now, and I'll provide you feedbacks. Okay, so thank you so much, Kenneth, for attending. Josephine Irowe, do you guys have any question? Do you understand the difference between primary and secondary infertility? This is an opportunity to get feedbacks from me directly. So please, the floor is open. Let's interact. Okay, let's see. What should a couple do if they suspect secondary infertility? Definitely, you have to see a fertility specialist, okay? So when you have checked yourself, you have to put into consideration the definition of infertility and your age. So if you are 35 years and above, and you and your partner are practicing PPP method, PPP method is the customized method of becoming pregnant in our group. It means when you pray, when you make love 48 hourly, then you seek help of a fertility specialist. So if you are 35 years and above as a woman, and at the end of the 7th month, you are not able to become pregnant, you need help from a fertility specialist. So at that stage, you already have an infertility. What's the right thing to do? You see a fertility specialist. When you get your fertility specialist, there are standard fertility tests we have to conduct. The essence of conducting those standard fertility tests is to define the infertility. So to discover if it's male factor, female factor, tubule factor, hormonal factor, womb factor, whatever factor it is, then we can begin to address it. So the right thing to do if you have secondary infertility is to seek help from a fertility specialist early. Then go through all the fertility assessment. Then once we discover what the problem is, we would have solved the problem by 50%. Okay, I love that question actually. Okay, if you have other questions, please still ask. What's the emotional impact of secondary infertility? You see, depending on the outcome of your pregnancy, so if you kept your baby, right? If your first pregnancy or previous pregnancies were pretty straightforward and you were just, like you can always become pregnant at will. When you don't succeed in becoming pregnant the second time, the third time, like you were in the past, it brings a lot of doubt. You begin to think about a lot of things. You begin to be emotionally down. You begin to seek for pity. You begin to lose your confidence. So emotionally and psychologically, both primary and secondary infertility, some couples might be having problems. They won't even know that their problem is more emotionally and psychologically based, because infertility has a way of taking your joy away. So when infertility takes the joy and happiness in your relationship, lovemaking will just jump out of the window. And if you're not making love, remember, if you're looking for a baby, you are supposed to be making love every 48 hours. So every other day. So if you guys are not careful, if you guys are not on the same page, infertility can damage the very fabric of that relationship. It can take the love, it can take the care, and both of you will start blaming each other. And by the time you start blaming each other, what's going to happen? You're not going to make love. And when you don't make love, you're not going to become pregnant. So the emotional burden of having both primary and secondary infertility can further exacerbate already a bad infertility situation. Okay? All right. Okay. Are there special concern for pregnancies achieved through fertility treatment? Now, depending on your age, okay? So when you get to 35, by default, your pregnancy is classified as what? High risk. So it depends on the cause of infertility before you achieve pregnancy. Some women might have gone for 2 IVFs, 3 IVFs, so many failures before they finally became pregnant. Some women might have obesity problems. Some women might have hypertension problems. Some women might have diabetes and a couple of other chronic conditions. So your health will determine how your pregnancy is classified. Anytime you have some risk factors, your pregnancy will be classified as what? High risk. So by default, when you get to 35, you are already classified as what? High risk. Because the older you are in your pregnancy, the more you're prone to having a couple of complications. Preeclampsia, gestational diabetes, increased probability of having your baby through CS, macrosomy babies, couple of placenta problems. So the older you are in your pregnancy, the more you're prone to be having more challenges. Okay? All right. I love that question. All right, please keep asking more questions. Keep asking more questions. Remember, today we are looking at 5 secrets of primary and secondary infertility. And we started with the definition of primary infertility, secondary infertility, who can have both of them, and what we need to do, especially if you've been on the corridor of looking for a baby for a very long time. So it's important you understand it better. Okay, so remember, if this is your first time of attending my YouTube's live stream, this is something I do pretty much every day. And when you subscribe, you're going to have a continuous daily upload of things that can help you to make better decisions. So subscribing to this channel will help you a lot, especially if you're looking for a baby, because most of our topics are centered around becoming a mother and a father. So please make sure you subscribe. When you subscribe, click on the notification. When you do this, every day I come live, you will participate openly. When you participate openly, you will have an opportunity to ask me questions one-on-one, and I can provide you feedbacks. So it's a very big advantage to subscribe. So please subscribe. Make sure you comment, make sure you click on like, and also share the channel. Tell your friends about Snowspirations Global Health Solutions YouTube channel. If you're in YouTube, if you're in Facebook, we have a page, we have a group, and if you're also my personal friend in Facebook, you can also check our timeline. We're also in Instagram. So these are all avenues you can leverage on my broadcast, which is pretty much every day. Okay, so let's see if we have any other question. If not, okay, what are the treatment options for secondary infertility? Pretty much the same application to primary infertility. So depending on the cause of the infertility problem, some people can improve their chance of becoming pregnant by simply modifying their lifestyle. So eating properly, exercising, avoiding stress, watching your body weight, sleeping. By doing this, you can actually improve your chance of becoming pregnant. Now, some people might need fertility drugs. Some people might need IUI. Some people might need IVF. Some people might go for surrogacy. So your own unique management of infertility is based on your own unique problem. So if you have hormonal imbalance, you can correct the hormonal imbalance. If your problem is due to fibroid, we can remove the fibroid. If it's infection, we treat infection. So it depends on what you have. So what you have as a diagnosis will drive your management protocol. Okay. Do we have any other question? Okay, when does a couple need to see a specialist? So time and age is important here. Now, before you even begin to freak out, especially for younger people, so if you're below 35, please stay calm. Try and enjoy your relationship. If you're in a marriage, try and enjoy your marriage. Don't go about gulping what your friends are telling you. Get used to getting down. Make love like tomorrow won't come. So younger you are, the better the chance of becoming pregnant. So before you even begin to freak out, if you are below 35, relax. Make sure you're drinking water. Make sure you're eating good food. So good food means you have to improve your intake of fruits and vegetables. Then you make love frequently. Matter of fact, if you're younger, you might not even need to be making love 48 hourly. 48 hourly is actually applied to women above 35 because you can easily become pregnant if you're younger. So before you begin to go out there to complain to your friends to begin to take Clomid, give yourself 12 months. So room in with your partner and make love for 12 months. The possibility you're going to get pregnant within the first year is very, very high. So at the expiration of the 12th month, when you get to the 13th month, escalate. You need the help of a fertility specialist. Now, if you are 35 years and above, 6 months, at the expiration of the 6th month, seek help. If you're 40, immediately. If you've gone into menopause, immediately. So every woman at any age can have different approach to their infertility problem. So your own approach to infertility management is dependent on your age and your diagnosis. So the earlier you do it, the better, but don't be in a hurry. If you are younger than 35, go back home. Get used to your partner and make sure that 12 months has elapsed before you begin to freak out. Okay, thank you so much for coming. If we don't have any other further question, I'm going to take my leave. But I hope you've been able to understand what primary and secondary infertility is all about. But this is what I know. You're going to be a mother. You're going to be a father. Now, if you follow me, if you are obsessed, if you develop what we call OCD, obsessive compulsive disorder in regards to your PPP. So you be a proponent and a practitioner of praying, of playing and practicing. If you can do this intentionally, diligently, you'll be a mother in 2022. So that's the secret. Regardless of the type of infertility you're having, regardless of the duration of your infertility, at the end of the day, before you sleep, so long as you're not bleeding, keep on meeting with your partner. When you have said your prayer, also go seek help. Unfortunately, we say different kinds of expectant prayers. We just want God to come down and solve all our problems. But we are not yielding. We are not asking God to connect us to the right people that will help us. So one of your biggest prayer as a believing for baby mother is to ask God to connect you to the right kind of people, to change your attitude, to change your perception of infertility, to do your own part, to give you that energy to make love 48 hourly. If you can do this, there is no challenge in infertility you won't overcome. So it's possible that even after 20 years of trying to have your own baby. You can defeat infertility and you can climb the podium next year and we can celebrate your baby. Okay, so thank you for coming. Now, Ebenezer, if I'm correct, you have the topic for tomorrow, right? So please, can you quickly share the topic for tomorrow? Please share the topic for tomorrow. And I think I have one other question. What are the causes of secondary infertility in men? Number one, it's your sperm quality. Now, the quality of your sperm as a man can correlate with your lifestyle. So if you recently added a lot of weight, if you are stressing, if your hormone level is all over the place, then you will likely have secondary infertility. Excuse me. So top contender for secondary infertility in men is post-seminal fluid analysis. So if you have low sperm count, or if you have azoospermia, or if you have motility problem, morphology problem, it can be a top contender. So you might have had 20 kids when you were in your teens, but currently, because of life, because you've exposed yourself to a lot of stress, you are not able to father kids. Some men can also have some structural problems and anatomical problems like varicocele. Okay? So those are the things that might likely... Okay, I have another question. Okay, let's see. What steps can a teen with fibroids or endometriosis take to preserve her fertility? This is a very, very important question. So if you have a caring setup, that means your parents are actually exposing you to the right knowledge. And if you are focused and wise, you can actually glean on understanding the female reproductive system properly. You can understand the role of sex. You can understand the role of infection. You can understand the role of safe sex in making sure you will be a mother in the future. And this is applicable to both males and females. So if you're a teenager, understand your body. Understand what fibroid is all about. Understand what endometriosis is all about. So if you have fibroid, the earlier that fibroid is classified into intramural fibroid, submucosal, subserosal, then the size, we can decide what to do with the fibroid. So early diagnosis of fibroid is important. If your fibroid is significantly small, is outside the womb, is not giving you any trouble, and we notice it in your teen, we keep an eye on it. Then you be careful. So you live healthy, you make sure you adopt good lifestyle, you don't go, gulping, posting all, you don't go making love without protection, you exercise, you eat good food, you eat your fruits and vegetables, based on the fact that when you don't do all this, they can actually make your fibroids to be bigger. Now, on the other end, when you have endometriosis, endometriosis simply means the cells we are ordinarily supposed to see only on the cover of your womb is seen elsewhere. So endometriosis is a very painful condition that can happen to women. It's actually a known cause of infertility. So if you have endometriosis, we have to classify it into mild, moderate, and severe. So depending on the extent of your endometriosis, we can give you some hormonal treatment or you can go for surgery. So my advice to teenagers is to make sure you understand your body. Now, the body of a woman is like a machine. So once your machine is not working properly, you will know you have a problem. So the first thing you have to do as a teenager is to study your cycle. So you have to know that the lower limit of your bleeding duration is 2 days. The upper limit is 7 days. Now your cycle is 21 to 35 days. So take time and study your cycle. The reason why you have to study your cycle and know the duration is to know the normal, so that when things begin to change, you can begin to plot them. Now, in fibroid, if you notice you have fibroid, the possibility you'll be having painful menstruation, which is called dysmenorrhea, is there. The possibility you might be having pain during sex is there, which is called dyspareunia, or you'll be having pain when you want to go pee, which is called dysuria. So these are all presentations that might tell us that you have fibroid. So early diagnosis is important. Now, unfortunately, most teenagers might not be self-health seeking. So the possibility they will go for regular checks is limited. So the key word in getting help to preserve your fertility, if you're a teenager, is prompt diagnosis. Very, very important. I love this question. So if you have teenagers at home, the earlier you teach them the right things, the better. And especially in this era of vaccination, remember that your teenagers need their HPV vaccine. HPV is human papillomavirus, and we've had a connection between human papillomavirus and cervical cancer. So you have to make sure you vaccinate your teenagers very early. When you give them the HPV vaccine, you can prevent them from having HPV infection. HPV is a sexually transmitted infection. Okay? All right, guys, I love that question. Very, very important, cool question. So thank you so much. I think that's the last question for the day. Ebenezer, please, can you share the topic for tomorrow so the audience can prepare and get their mind in tune for tomorrow's broadcast? Now, if you're in our group, remember that every Friday we have our 4 days Fridays. So please make sure you join our social media handles. Every Friday you have an opportunity. We're going to be in YouTube, we're going to be in Instagram, we're going to be in Facebook, and you have an opportunity to interface with me. I'm going to select a topic and we'll all learn and get better. Okay? All right. Okay. Thank you so much for coming. In the absence of any other question, I'm going to take my leave, and I truly appreciate you coming this evening. I'm just waiting for Ebenezer to announce the topic for tomorrow. Then we can all take our leave. Okay? Ebenezer, are you forthcoming? If you can share the topic for tomorrow, so I can take my leave. Okay, let's see. All right. Okay, thank you for coming. Remember to subscribe. Okay. Okay. Ebenezer is having issues with his device. Okay, no problem. We're going to announce the topic for tomorrow. And just make sure you hang around about 7 and you have an opportunity to, learn one or few things. So thank you for coming this evening. I appreciate you. Don't forget to subscribe. Subscribing to this channel can change a lot of things about you. Now, September is going to be a September to remember in our group. So gear up. You're going to become pregnant. You're going to have your babies. You're going to learn better. God is going to fulfill all his promises in your life. Okay? So don't worry. Just make sure you're doing your own part and God will be God. All right. Okay. I'm going to take my leave now. Thank you so much, Kenneth. Thank you, Ebenezer. And I think we have one more attendant. I've forgotten her name. So thank you for coming in anyway. God bless you and enjoy your evening. Bye bye for now.